Hello, my name is Dr. Aidan McGarry and I work at Loughborough University in London at the Institute for Diplomacy and International Governance. My research focuses on Roma communities. Roma are the largest ethnic minority group in Europe, numbering between 10 and 12 million people. They're also the most vulnerable and persecuted minority group in Europe. And a lot of the issues that many Roma face is due to violent anti-Roma prejudice, or Romaphobia, as I call it. And this plays out in lots of different ways, but it means that Roma are frequently scapegoated and blamed for various social, economic, and political problems. So it comes as no surprise that since COVID-19, many Roma are being vilified in the press by politicians and by the public on social media, and is already exacerbating the marginalization that many Roma communities endure. Now, millions of Roma across Europe are facing a humanitarian disaster. This is because many Roma live in areas where they inhabit substandard housing, that they are unable to access even basic or adequate healthcare provisions, and they live in areas with kind of poor sanitation. This is compounded by the fact that many Roma have lost their jobs due to COVID-19. Many Roma practice professions that are in the informal job sector, so for example, collecting and selling scrap materials. And a lot of these kind of work is prohibited due to social distancing. It means that many Roma are unable to access the government assistance programs, which are there to provide for more kind of formal jobs. So many Roma are struggling to kind of pay for food, to provide for their families. And so the COVID-19 crisis has really hit Roma communities particularly hard, and they're really worried about how this is going to impact on their jobs, their livelihoods, and their homes and their families. To make matters worse, Roma know that they probably cannot really rely on the government to provide for them. And instead of providing for them, many governments are actually responding by implementing very restrictive and repressive measures. So on top of more general measures to prevent the spread of COVID-19, authorities in Slovakia, Romania, and Bulgaria have introduced additional restrictions specifically for Roma communities, sometimes resorting to the use of police and military force. So in Bulgaria, police have kind of set up checkpoints around a Roma enclave, restricting movements. And in Greece, more kind of nationalist European lawmakers have called for sweeping shutdowns of so-called Roma ghettos, labeling them as breeding grounds for the spread of COVID-19. And racial slurs have been picked up and spread and proliferated on social media platforms. So all of this, there's a fear that all of this is going to kind of legitimize and allow more racist government interventions to be implemented. And it is true that many Roma live in settlements with in cramped conditions, with inadequate sanitation and running water, and so on. But this is due to the long-standing inability of local and national governments to really provide for the Roma communities. So this is really an opportunity for the government to step in and step up and ensure that they are providing for the citizens for their own citizens. So what can we do? Is there anything that we can do? Well, actually there is. There is an NGO called eRomna, which is based in Romania and is a grassroots Roma-led NGO. And if you wanted to, you could donate a little bit of money in order to support their efforts to provide directly for Roma communities. And you see the link here. Of course, there are hundreds of, thousands of really great organizations across Central and Eastern Europe which are working on behalf of Roma communities or led by Roma communities. And the reason I focus on this organization is because it focuses on Roma women. Roma women face triple levels of discrimination for being women, for being Roma, and for being Romani women. And so this organization really attempts to address the specific needs and interests of Roma women, and does so in a way which is empathetic to the community and works very directly in response to the needs of the community. And I think this is particularly important when the state is unlikely or unwilling to address the needs and interests of this group.